Hello, this is Dr. David Oster, and this is a presentation that I put together on a patient who sustained a clavicle fracture and a scapula fracture in 2009. This patient was cycling and hit another wheel of a cyclist in front of him and flipped over the handlebars. This is a three-dimensional CT scan of the upper right portion of the patient's body. On the left-hand side is the humerus, which is the upper arm bone. There are the ribs, the shoulder blade, and then the clavicle or the collarbone. And the fracture of the collarbone or clavicle is outlined with the arrow there. And it's a comminuted fracture, which means it's in multiple pieces. So this patient, on the day that he fractured it, it was an open fracture, so it was cleaned out. And at the time of surgery, it was fixed. Now, looking down upon the fracture, there is comminution. It's in multiple pieces, and one piece is what's called a butterfly fragment, and that's in the front part of the clavicle or collarbone and is outlined here in white. This piece needs to be reduced to the piece on the left-hand side, which it's sitting up against, and this piece was reduced, and then two screws were placed to hold this one piece to the other piece. Now there are two pieces that need to be fixed, the outer piece on the left-hand side and the more medial piece on the right-hand side. So the next step is to reduce the fracture. So the medial piece outlined here in white was reduced down to the lateral piece, and it was rotated and then held in place. Those two screws that held the butterfly fragment were already in place as shown here, and then a plate was placed on the upper portion of the bone to obtain and maintain the fracture reduction. And multiple screws were placed in that plate, through the plate and into the bone as outlined here diagrammatically. Now, radiographically, this is what it looked like. The fracture is where the two large screws are, and then there is a plate that is on top of the bone covering the fracture, and then there are multiple screws on the left-hand side and multiple screws on the right-hand side. Now, this patient also had a scapula fracture. If we rotate around, the shoulder blades in the center portion of the screen or the scapula, and the fracture is outlined here in red. This fracture was non-displaced and was held together by the surrounding musculature, so this fracture did not require any surgical management. So this is a presentation of a patient who sustained an open clavicle fracture as well as a scapula fracture or shoulder blade fracture. If you would like to look at other information, either text or video, please visit my website, davidostermd.com. For an appointment or evaluation, please call the office 313-214-4500.